this year marks your 10-year anniversary of Power Nutrition. And so you've been putting out some reports, just the learnings you've had, what's working, what hasn't been working the past 10 years. So to start out, could you just give a high-level view of what some of those reflections are on the progress you've seen and the challenges that still remain?
Yeah, sure. And to dive, first of all, thank you for inviting us, the Power of Nutrition. We are turning 10.
Happy birthday.
Thank you so much. And last many months, we have been investing a lot of effort and energy in terms of culling out all the insights that we have based on all the different partnerships, 26 programs across 17 countries, a reach of 180 million women, children, and adolescents, a portfolio of $647 million US, working with so many different funders and implementing partners. So before I dwell into that, can I just request audience to say, if you agree to my statement, just raise your hand. Undernutrition is an underlying factor for almost 45% of death among children less than 5 years in the world. You agree to that, or 45%, right? Almost 45% folks in the room said yes to that. In terms of the percentage of ODA that goes for addressing nutrition is less than 1% in the world. Do you agree to that or not? Yeah. So almost 1% we got as an answer as yes. So something that contributes 45% of under 5 mortality among children gets less than 1% of the ODA. So that was the context in which the Power of Nutrition came into existence in 2015, created by SAFE, DFID, and UBS Optimus Fund Foundation. And we had UNICEF and World Bank as a core implementing partner. So some of the key things that we have learned in terms of what you asked right now is, first, most of the thing that we succeeded in terms of reach, impact, numbers has really been helped by the match funding model that we had. That was really useful. DFID provided us the platform funding, which we utilized to get the match for new funders across new sectors, different sectors, getting private sector funding to address undernutrition as well. So that was one key aspect, getting the platform funding. And it really helped us immensely in the initial part. And then the fact that we were working as a co-convener, where we were like as a platform which bring funders and worked with our implementing partners, the 11 implementing partners that we have, really helped. It's a kind of a thankless job, but like Ethiopia program, we had 4 funders funding different interventions to implementing partner, UNICEF and Action Against Hunger. And the government of Ethiopia prioritizing, this is what we want, this is where we want the program to focus on. So convening all that, managing the entire ecosystem was quite interesting. And third thing from the learning of this 10 years, the key thing that stands out for me is, I say 3S: scale, systems approach, and sustainability. So every program investment that we have, we focus on these 3 aspects right from the outset. And it's really important because what we have realized across working Asia and Africa is government wants scale being delivered through the systems, and in a way that it is not dependent on some funding throughout. They want it to be sustainable also in the long term.
Yeah, so and that's the name of the game right now too, right? And financing and funding is more restricted than ever. And so when you think about how you can make the case for investing in nutrition, given the impact it has, but the minimal amount there, what are some of the arguments for why that is a smart investment, particularly amidst a backdrop where there's a lot of people trying to make the case that their issue is the smart investment?
Yeah, and I don't disagree to the fact that there are multiple. I'm a medical doctor. What I'm doing in nutrition today, nothing of this sort was being prioritized when we were getting graduated and post-graduated. But in terms of and I was working polio eradication, routine immunization, I see all those principles of what worked there works in the area of nutrition as well. But the fact that it's an underlying factor for 45% of deaths among children less than 5 years, it's immense. World Bank just came out with an investment framework last year, and every dollar invested in nutrition gives you a return of $23. And every investment, every sector has those reasoning, those rationales, and none is more important than the other one. The example that was shared in the last session, I'll just go with that analogy in terms of the firefighters in the city. That's very important, right? Nutrition is like the green cover that you have in the city, and it's amazing to see in Geneva the kind of green cover we have. Um, but we don't. It doesn't kind of becomes a priority so much till the time all that green cover is lost, and then you see what is the impact of losing that green cover at that point of time. In terms of the approaches that we have mainly done, we have seen three aspects really stand out where we brought a lot of new funding into the nutrition area. One was working with the World Bank. So we have 9 investments with World Bank. So our funding, which we pulled through different funders, helped leverage a lot of concessional loan from the World Bank. So that's the lion's share of our portfolio. So almost 450 million of the 647 million is almost World Bank partnership. It works for everyone. It works for our donors. They get the leverage, they get the impact, higher leverage. It works for World Bank because it strengthens their negotiation with the government, where what gets prioritized is more evidence based, more data driven, and more kind of focused on intersectoral aspects that we want to always prioritize. And it works for the government as well, because they don't, with the concession loan that they're taking, this becomes a sort of a sweetener, which is a grant funding, which doesn't have to be paid back. So that works out. Our second model, apart from World Bank, is working with UNICEF as an implementing partner. And most of the UNICEF programs, we have a strong component of domestic resource allocation. So the pool funding that we engage with UNICEF with, they bring the match funding from their side. And in that, across multiple countries, there is component of domestic resource allocation, which is also there. And third aspect is private funding, where we do see that different funders who are interested in different aspects. Someone is interested in working with the garment factory workers, and they are supporting the nutrition program. So they're not looking at from the nutrition perspective, they're looking at the constituency that they are serving, but it works out pretty well in terms of bringing different stakeholders together with the matching model.
Yeah, so thinking about bringing different stakeholders together, and everyone in this room and joining online is working on global health in some capacity, but from different perspectives. What would be some of the lessons you've learned that, or advice you would share about how they should be thinking about nutrition integrating into whatever aspect of global health they're working on?
Thank you for that question. I think that's very important, and I don't see nutrition to be standing in silo. Unfortunately, nutrition is something which is an outcome of multiple deprivations. An unimmunized child is more prone to being undernourished. A child who is not having the early childhood support is more likely to be entering into that phase. A child who is the family which is not providing support through the social protection outreach network, that child is more likely to be deprived and landing into that state. So we are looking at some creating nutrition programs, not just as a nutrition as a food aspect, but working across different sectors. So nutrition plus immunization, we're working with Gavi, with other stakeholders on that. Nutrition plus early childhood development, working with UNICEF and many funders who are interested in early childhood development as an area. Nutrition plus social protection is an area where we find that it is helping us reach the last mile much efficiently, because government is already putting a lot of resources in reaching those people at the through the social protection intervention. So and it also going back to the component of private sector, because it enables different players, not from food and beverage per se, but other stakeholders who are interested in different aspects of society to be also being part of this journey and coming together.
So recently, as in March of the Nutrition for Growth Summit, and what do you want to see happen, come out of that, and what are the highlights that came out of that?
So for me, 3 things really stood out during the Nutrition for Growth Summit, and it was really heartening to see that. It was there was a lot of talk and examples being shared, by government and different stakeholders around integration, the multisectoral component. It was not just, let me just talk about anemia, or let me just talk about treatment of wasted children, or it was integration across sectors which was coming through. That was really very heartening to see. The second, which I would say is even bigger achievement, is the countries coming forward and sharing at the global platform. This is what we want for addressing nutrition. This is my work across different sectors. This is what I want to do. And Ethiopia led an example. They have the Secota Declaration. They shared there what they have done between in last 4 years and how they are scaling it across different geographies, and how they invited all the donors, all the implementing partners to come and commit to what the government's vision is going ahead. So that was really heartening to see. It was country led rather than led and driven by someone from somewhere else. So that these two things really kind of stood out for me. And I think there is more and more collaboration, and more people are looking at, in this funding cut situation that's happening, how is it that we can become more efficient? How is it that we can sing from the same song sheet rather than fragmenting this sector, which is already quite fragmented?
I think all big themes that we're talking about this week. Well, thank you so much. And thank you to Power of Nutrition for being a partner with us today. If you want to, you can see a QR code and learn more about their learning series from their past 10 years. But thank you and happy birthday.
Thank you so much. And we have a webinar on 3rd of June where we are sharing the entire learning of last 10 years. You all are invited to that.
Great.
Thank you.
Thank you. Thank you. We are going to continue the conversation on, again, looking at new financing models, and I will introduce my colleague, Andrew Green, to the stage to lead that conversation. Andrew.
Thank you very much. So I think one of the key takeaways over the past few days has been that there are more health priorities than ever before and less money to spend on them. And the answer to solving that problem seems to always be looking to domestic governments. So I'm really excited to have a conversation with two really distinguished presenters about what the reality of that is, how possible is it. So I'd like to welcome to the stage Dr. Calypso Chalkadou.